A direct anterior total hip replacement is a surgical technique that allows us to perform a total hip replacement without damaging any of the muscles around the hip joint. By performing the technique in this way, we preserve all the muscles and the soft tissues around the hip, and therefore this means faster rehabilitation for the patient. The benefit of a direct anterior approach lies in the fact that we perform the hip replacement without damaging any muscle. By not damaging the muscles and preserving the soft tissues, we allow the patient to recover faster without significant pain and return to their activities of daily living as well as sporting activities much faster. Almost all patients are suitable for a direct anterior hip replacement. There are few exceptions that are based on anatomical characteristics of the patients, but this is a discussion to be had with the individual patient in preparation for their hip replacement surgery. The risks involved with a direct anterior hip replacement are the same risks as those involved with all other types of hip replacements. In preparation for the hip replacement and during the consenting process, these risks are going to be discussed in detail with each individual patient, and explanation will be given of how we deal with these complications if and in the unlikely event that they happen. All operations should be considered as big operations and should be approached with respect. Hip replacement surgery at the moment is a routine operation in orthopedics, and the principal aim of hip replacement surgery is to return the patient to their normal quality of life and normal activities of daily living without pain. Typically, recovery from a hip replacement surgery is between 4 to 6 weeks. With the anterior hip replacement, because we preserve all the muscles around the hip joint and we avoid any injury to the soft tissues, we aim for recovery to be much faster. Typically, after a total hip replacement, you expect a patient to be in hospital approximately 3 days. With the anterior hip replacement, because of the faster rehabilitation, given the fact that muscles are preserved, we aim for the patients to be discharged within 24 hours of the operation.